So Dr. Munir, there seems to be a lot of hype about the COVID-19 virus and the infection. Now, is this hype justified?
Oh, yeah. Thank you very much, first of all, having me on this panelist. That's wonderful. First time opportunity to interact with such a wide audience and really to contribute to the society. So in scientific history, we have seen two kinds of diseases. The first kind of disease is the one that are very lethal. For example, Ebola virus. So more than 80 out of 100 infected people could die, very lethal. And then we have seen other infections, those are less lethal and have literally no impact onto the casualty. They don't kill the host, in our case, in the human. So the first one, the first category, always short limited. The one that is highly lethal is short limited. They go very quickly because viruses need us to survive. The other category, the one that does not kill many people, they are really not bothered in the society because they are not of that concern. Unfortunately, this COVID-19 has found a middle ground. So it is highly contagious. It is spreading between people quite effectively, but at the same time has a quite good impact, or in other words, worse impact onto the health. What we have seen so far, the countries, those have taken very drastic measure right at the beginning of the time. 7.7% of those who were infected, they were died. But then the people or the countries, those were really late in taking those actions. Over there, the case fatality rate is really high. For example, in Italy, 10 out of 100 infected people have died, which is really serious. So just putting into the whole context, this virus got some unique features. And our understanding in the scientific community is that it is here to remain. It is not short-lived. It's a long-lived and has certainly impact.
Okay, Dr. Munir, we recognize, I mean, it's something we're quite familiar with. We're, the common flu, and we recognize also that it kills, quite a considerable number of people all around the world. But why are we getting told that our hospitals are not going to be able to basically react to the demand that is expected of them? With this particular virus? What makes this virus so different relative to the others?
Yeah, well, you mentioned about influenza. Certainly influenza is one of the biggest burdens actually in our healthcare system. But since it became seasonal, so every year it comes, so hospitals are relatively prepared for it. They know in winter it's gonna come anyways. And with the influenza, the case fatality rate is really low, is 1 out of 1,000 people infected, they die. With the COVID-19, first thing is that we were not prepared. It just came 3 months before and it has taken the whole world by storm. And also the mortality rate is really high. I mean, compared to this one, it's like, even if we take the average of the whole global, perspective, 3 out of 100 mean 30 out of 1,000. If we compare with influenza, they die. So it has first very short history, unexpected outcome. The second thing is that it has quite high impact onto the case fatality and the deaths. So both of these came up like a surprise to us. Therefore, our healthcare system was not really prepared to cope with the burden of this disease.
So is there an issue about avoidable deaths? So there are clearly unavoidable deaths, and then we have this issue about avoidable deaths. And these are deaths, for the audience, that clearly, if we have all systems in place and things were functioning efficiently like they should normally, then those deaths could have been avoided. So are we in a state now where we're looking at a considerable amount of unavoidable deaths? Is that the issue? Is that the main focus of why we're panicking so much?
I think, unfortunately, that is the situation, but right. it really depends. I mean, if you take the global perspective, different countries, they took very draconian and drastic measures right from the beginning. So they tackled very well. But the majority of the countries here in the Europe and including United States, they are relatively behind in sort of putting all the, eggs in the same basket, really tackle it. So over there, the chances for this one to have a lot more impact than other countries we have seen, like Hong Kong and Singapore, this is going to have a lot impact into many countries who took the measures really late, including many countries in the Europe.
So from this perspective, Okay, let's look at UK, for example. What's the estimate of the number of deaths that are going to happen? Okay, so these are just estimates. We recognize that, and they're not completely accurate. Just in the UK, how many deaths are we looking at from COVID-19?
Yeah, so let me explain one term that called herd immunity. I think government in the UK has been working very actively to maintain the herd immunity. By herd immunity is that how many people in the population are immunized against the disease. Those people will be protected, and a fair proportion of people in the community, if they are protected, the rest will be protected, because virus would not transmit from immunized to unimmunized people. So government has been working on to underlying, the herd immunity. So herd immunity to achieve for COVID-19, which has a reproductive rate of around 2.5%, 60% of the population need to be infected to get the herd immunity. So 60% of the population in the UK mean 40 million out of 67 million, roughly. And if we look onto the death rate of this virus, which is, as I was mentioning, 0.7 to 10%, which is really big range. So if we take even a conservative approach, we are talking about 2% here in the UK. So 2% of 40 million, we are talking still about 800,000 people. So 800,000 people need to be dead to get a 60% herd immunity. But again, here a question comes: how drastic measures are put in place, and how much time they do consider to put in place. If they do so, then certainly this number will decrease significantly, and then the herd immunity would still be achieved, but the death rate would decrease significantly. But at the same time, if vaccine or therapeutic would become available before they reach 60% of infection in the population, then would also have a very high impact.
And we will talk about immunizations and various other things later on. But generally speaking, okay, so we recognize the scale of the concern in terms of the number of deaths we're looking at. I think we also recognize that this is mainly affecting the elderly and the vulnerable amongst us. So clearly, we recognize that this is very serious. Now, different countries are approaching this from many, many different ways. From your expertise, somebody who's really looked at this and you've dealt with this for some considerable amount of time in terms of the details, what's the best approach here? Should we press for draconian type sort of social isolation and distancing? Should we sort of try to take a balance? Like, for example, in the UK, we're trying to draw a balance in terms of the impact on all the different services and how that may even lead to further deaths because of some of the lack of services that we can provide, and poverty and various other things. So what's your take on this? What would you advise would be the most appropriate approach here?
Precisely. I mean, as some of you probably already heard today's press conference by Boris Johnson. So they have estimated 1.5 million people in the UK, those are falling within the vulnerable group, like having underlying causes or aged 70 plus. So this means that 1.5 million people in the UK, they are at a high risk of having bad consequences, really. So now what can be done to really minimize this impact? I think at this moment, especially when we talk about UK, the only thing that we can do, to be honest, is really to protect and shield this vulnerable community. Right. If we do so, then of course the impact would be significantly reduced, because we do know the younger people and also the children, they are not really that much affected. So our really main focus is on 1.5 million people who are really at that risk. Now the next question is how to protect them. Right. The first thing need to be done and basically need to be realized is that although young people, they are not under severe threat of this infection, but they are actually the main source of infection to the elderly people. So every individual in the society has now a critical role in not only minimizing the impact, but also ensuring that our elderly people, or the people who are frail or having underlying causes, they are protected. Because more we protect them, the higher chances are that we will have less impact onto their health, because then our healthcare system would really cope with them as we stretch the curve along the line. So I think what we are doing now at this moment is really to protect that vulnerable community, really ignoring the other, but everyone has to take the responsibility.
So, Dr. Munir, just give us 4 ways that we can protect ourselves and our families from coronavirus?
The first and the foremost important thing is staying updated with the latest information.
Okay.
I always been saying is that this is a changing scenario, is a prevailing situation. Every country is taking daily basis as a new information is coming in. So if you are not, if
we
you
don't know enough, there's still more information coming to us, yeah?
Precisely. Every day there is new information coming up, because even in the scientific community, we are learning on everyday basis, because this is a new virus, new disease. Countries are prepared at different scale. The first thing is staying updated with the latest information. The second important thing is really to ensure your personal hygiene. Washing hands, avoiding social gathering, and keeping everything tight and clean in the house, because some people don't really embrace and appreciate. There are tiny things that can make a big difference. For instance, the door handle in the main entrance of the house. This is something that will be touched by every member of the family. Okay, so this need to be clean and tight, kept clean and tidy. So the second option, the second thing that I mentioned is the personal hygiene.
Right.
And the third thing, probably the most important among everything, is that follow the guideline government has provided onto each and every step. For example, when we talk about UK, now there is a lot of recommendation ongoing at the moment, is that the social distancing, avoiding gathering, but at the same time, that is also confusing, because I was having conversation today earlier on the LBC radio, where people were asking, question about whether, well, the social gathering is discouraged, but at the same time, people are going to the parks and so on.
Yes.
So that is that. The fourth thing that is important, but that is down to the government to do so, is to have a convalescent sera. So that is the sera, or the blood basically collected from the people who are already recovered.
Right.
So as you know, by now, I think there are around 280,000 people infected. Out of that, like 90,000 people are recovered. I mean, I'm talking about the globe. Those people are having antibodies in the blood. So people who are recovered, if they volunteer to donate the blood, we can extract the antibodies out of that, and those antibodies can be used to treat the people who cannot survive otherwise, for example, underlying causes or elderly people and so on. The fifth thing, if I can really say so, is really to take care of every person in your neighborhood. Not only as being Muslim, because that's what we've been taught, but at this moment, beside every other race, religion, belief, whatsoever the color is, please do take care of every neighbor in your around. For example, I can give you my example. Today, myself and my daughter, we written my business card on the back of it, that anyone in our colony, anyone need any help from us, we will be able to provide you. So we drop every card into the whole colony. We have like 70 houses. And some of them, they already know me over the media. So anyone who has confusion onto any point government is proposing, do talk to me. If I would know, I will tell you straight away. Otherwise, I will figure it out and come back to you.
Okay. Thank you very much, Dr. Munir. That's very, very useful. So in essence, we understand how major, how severe the coronavirus is in terms of some of the death outcomes that we're expecting from it. We also recognize that there are certain things that we need to do. So there's something about social isolation and distancing. We also recognize that this isn't just something that is concerning for the elders, but rather everybody in the community has to play a role here. So we're looking at even the young, and sometimes the young can be quite sort of not too considerate of this, because their lifestyles are quite different from our elders. They tend to engage more, they interact with each other, but yet they could be bringing this disease back to their homes, to our elders.